So, okay, we understand the soldiers, the PTSD, and there's great work that you've both been involved in with that. Let's talk about the adolescent group. And I know in Wake County, the county that Extivita is located right next to, we're actually, it's in Durham, right on the borderline there. But Wake County, I'm familiar with. There's some 3,000 adolescent concussions in sports and other, injuries or caused by other actions. What I understand in talking to some of these concussion doctors out there is that time is the only thing we have. Time heals all wounds. There's that expression out there when we have hyperbaric oxygen. And so perhaps some case studies or some of what you've seen with the adolescents.
One of the things that I'll tell you that he say, time will heal. Time also makes things worse. Okay, and I'll tell you a case in point. Okay, and this is really not an adolescent, but this was a recent recovery where hyperbarics was used to make a difference. There was a defensive back. His name was Shazier. He was injured, and he had a neurological injury with a contusion to the spinal cord. He was looking at being a quadriplegic. The thing is, now what we're looking at is the implementation of hyperbarics in a timely fashion before any swelling causes a scar to form will actually be the difference between whether he's a quadriplegic or whether he's walking again. Now, Shazier was for the Pittsburgh Steelers. He was managed by an interesting doctor named Joe Maroon that was part of the movie Concussion. Actually, he wasn't in it, but his character was represented in it. And I think what in treating Shazier, he's seen the benefits of hyperbarics, and that's what it is, just approaching each member of the medical community and saying, hey, which one of your patients would benefit from use of oxygen to relieve hypoxia and inflammation? Because that is at the root cause of everything we treat. And that, so the end story is Shazier is now walking, okay? There are other stories like this, but if you can get them involved early, okay? That's just like in stroke. They say, hey, listen, a stroke is an evolving thing. Well, it's evolving if you let it evolve, but if you actually have a timely implementation of therapeutic hyperbarics, then it may not be evolving. It may be stopped in its track. We as a community need to be better at communicating with the mainstream medicine and saying, hey, listen, we have a therapy that can make the difference in your patient. It's not an alternative. It's actually the drugs that are the alternative. So let's try to reestablish and take care of the hypoxia that's causing the injury.
So hypoxia leads to inflammation, right?
Yeah.
I mean, we talk about it all the time.
In terms of concussion and acute and the adolescent, like you brought up just a few minutes ago, I've seen several in the clinic, and if we get them within that time period that Tom was talking about, preferably within 24 hours, but that's not realistic sometimes, but at least within the acute phase, which is 72 hours, then we usually can treat them with 2 or 3 hyperbaric dives, and they get returned back to their baseline. And I've seen this time and time again. But it doesn't mean that if we get them in a subacute state or even the chronic stage that they're beyond help. We actually have seen folks, I know you're talking about acute, but I also want to emphasize that even if it's 10 weeks out or a year out or 10 years out, we've also seen benefits in those folks. But if we get them right away, it can bring them right back to baseline immediately, like within 3 dives, like I said, 3 to 5. But and I've seen that.
So is it fair to say that so what are the factors that are present in determining how many treatments you might need, severity of it, would be your age?
Absolutely.
Time from injury.
Yeah.
Okay,
Yeah.
and then And then how many treatments you might need is going to be based on that, of course, the protocol around that.
Yeah.
Those are the real factors there. Is that anything else that?
Well, the time is actually very important. And like Elena said, the earlier that we can implement hyperbarics, the less the number of treatments. It's not saying that we can't have a positive effect with down the line in chronic, but it usually takes a lot more treatments at that point to return to baseline, if you're able to return to baseline. So that's the issue.
I think one of the other things that you could say is as factors that determine how many dives they need or something to that is actually their history of concussions as well. Because even as an adolescent coming in, they might have had several concussions because they've been playing football since they were 9 years old, or whatever sport they've been playing, soccer with a heading. So if it's been multiple concussion and then we're seeing them for the first time acutely, that could also possibly change the number of treatments that they might need. But still not 40. We're still talking about maybe under 10, and maybe some comorbidities. I don't know if someone's coming in with chronic illness in addition to that too. So if they have Lyme disease or some condition that could be contributing to some neuroinflammatory response, then that could also skew the number of treatments that we might have. But in general, it would be just, we were saying maybe 3 if we get them right away.
So if someone, a child is 12 years old and they get a severe concussion,
Yeah.
you might be able to cure that in how many treatments?
Did you say severe concussion?
Fairly severe. I mean, they've been concussed. It's
Yeah.
Clearly they've had a brain injury. How many treatments? Just an idea. Are we talking 40 treatments? Are we talking
No.
5? What are we talking?
I-
Within 24 hours or
Within-
48 hours?
Within an acute phase, if you remember 7. 7 to me we were taught 7 treatments. 3 times in the first 24 hours, 2 times for the 2 days, and then that takes care of most conditions, then puts them on a path to healing. Okay. The thing with hyperbarics is, and it's gotten a bad rap for extended protocols, like 40 treatments, 60 treatments. Who can do that? Who can afford to do that? Why doesn't insurance companies reimburse for this? Because usually it's an extended course of therapy that requires an extraordinary amount of money. And that's one of the chief things that holds us back. One of the areas that hyperbarics could be used in would be preconditioning and post-operative treatments. In that role, it could be incredible in its impact on healthcare.
Oh, yeah, that's another field that we could really help. Yeah,
Much better outcomes. I guess, when you do
incredibly.
that.
I've seen that time and time again as well.